first. I could bring him a little bit toward me. No, don't help. I'm a big girl. I can do this. I can take his bottom leg, bring this right leg up. Okay. Relax your leg. Never mind. Okay. What I'm going to do is I'm going to take his bottom leg and push it back. That's going to induce extension at L5S1. So his hip extension is going to give us that. Okay? We're okay with that, right? Or I could physically extend him, but to use the leg is not such a bad thing. I'm going to switch hands because I'm always monitoring for tension at L5S1. I don't want to overextend him because if I overextend him, he's going to be extending up to here. So I'm just extending to that level. Now what do I want to do? I want to rotate him right. Right?
Yeah.
Right. So how do I do that?
Drop your shoulders.
I'm going to rotate you back. So relax. You okay?
A little cavitation.
A little bit. Yeah, so we already got some cavitation. And if that happens when you're doing this, you're like, it doesn't always happen, but sometimes just positioning them will give you cavitation.
So you're rotating them at like the inferior segment. That's where you're rotating them, right?
I'm feeling L5 starting to move on S1.
Right.
Okay, so I'm feeling that's where we are here. Now I switch hands again because I'm always trying to monitor at this level. Now I want to induce side bending. Okay? Side bending to the right. So how do I do that?
Lift the legs up.
I'm going to bring his leg, relax your leg. I'm just going to lift this up. Now you made a really great point. I had already taken up motion in two different planes. He's not going to have a lot of motion to give here. Okay? So as I do this, I feel like I'm getting a little bit of side bending here. Okay? So I'm just lifting his foot up. So now what we want to do is get a muscle contraction to happen. So what I'm going to do, simple, just gently pull your foot toward the floor. Gently. Yep, top foot. Yep, against my hand. Push your heel down. Not that way, straight down like that.
Oh, okay.
Yep. There we go, not even that hard. Easy. 6 seconds. Relax. He relaxes. I'm going to reposition him. So I'm going to take up a little more slack in the different barriers. So we're going to repeat. Extension is hard. For someone like Calvin, I might even just skip it and just go right to rotation, give him a little rotation. New barrier. New barrier here. Okay? Go ahead and pull down again. And it's not a strong contraction, right? It's pretty easy. And relax. Okay? Again, what I typically do with smaller patients is I would give them a little more extension backwards. But I don't want him to help me either, so you have to be careful with that. If you get 2 out of the 3 barriers, you're probably fine. A little more rotation, and you can help by just holding your arm back there if you want, and then a little more side bending here, and pull your foot to the floor.
Grimacing a little, Kelvin.
Shouldn't hurt. Does it hurt?
No, just like,
Stretching?
yeah, like everything just like locked up.
Yep. Okay, and relax. Yeah, he's at his max. He's
Yeah.
like he's maxed out. Let's have you flip over onto your stomach.
You're showing.
This one junction. So I'm on that space here. Okay, I'm going to come right through your shirt to palpate that. What I want to do is just bring your leg up so I know I'm right at L5. What I want to do here is I'm going to extend the leg. Now, what am I doing by extending her bottom leg? I'm extending her leg to kind of get lumbar extension. So that's what's going to help to extend. You don't help me though, okay? So I'm good. Be careful when you guys push their leg back. Don't put your hand over their kneecap, okay? Because that could hurt their knee. So try to come above just get on the thigh when you push their leg back. So try to relax, and my hands are freezing. But right about here is where I feel like, okay, I'm getting some lumbar extension here. So I'm just feeling a little bit of movement happening between L5 and S1. Now I'm going to switch hands. Okay, and I'm still palpating. I'm going to rotate her back. And I'm going to just bring you back like this. And because it's a sacral torsion, she's going to rotate all the way back. Because how much rotation do we have to take up in the lumbar spine to get to the sacrum? All of it, right? So she's going to go all, I don't want to feel the sacrum rotate, but she's going to rotate all the way back until right there is where I feel like, okay, that's where we're getting rotation at L5S1. Okay? So I'm still monitoring that segment. Now what I do is I drop the leg off the table, and that's going to give me the side bending component. Okay? So I drop her leg off the table, and all I'm going to do here is a very gentle contraction. I think he might have it. He does it like this. He says, put your hand on the side of the patient's knee, and you have the patient push up. What works, I find, because patients tend to they just contract too strongly for that, I put my hand on the outside of their foot, and I just say, gently push your foot up toward the ceiling. So I'm going to be here. Go ahead and just gently lift your foot toward the ceiling. Yep, just like that. It's 2 pounds of pressure. Okay, she's going to relax. Okay, I'm going to take up the next 3 barriers again. So I'm going to bring you back into a little more extension. Okay, a little more rotation. Good. I'm going to drop her leg into a little more side bending. So by bringing her foot down to the table, go ahead and push your foot up toward the ceiling again. Yep. So we'll just do that. And then again, lay them back on their stomach. Check to see if you corrected it. Check extension, and hopefully you're good. Okay? So if we're going to treat a left on left torsion, I'm going to, first I'm just going to bend your legs up. I'm going to flex him up until I feel motion in all 5 S1. I'm going to have him roll forward. So go ahead and roll your trunk forward. Good. So he's maxed out. I'm going to drop his legs into side bending. I'm going to support his thighs. And I'm going to ask him to push his feet toward the ceiling. So go ahead and push your feet up gently toward the ceiling. Good. He relaxes. I repeat. I give him a little bit. I bring him into a little more flexion. I can ask him to take a deep breath and sink into a little more. So deep breath, and then reach down toward the floor a little more. And then a little more side bending. And then he pushes up. Good. And then we do that 2 more times, and then we reevaluate. So again, I would use a bigger ball. But with the ball, now roll forward a little bit. Like that. So now what we can do, this is a patient, if someone has if they're bilaterally sacrally flexed, she is. What you can do is do the technique over a ball. If she's bilaterally flexed, what would I want to do? I'm trying to get both sacral bases to counter-nutate. Right. So I could do the technique where I just stabilize and just give some counterforce. Go ahead and take a nice deep breath in. Really big inhalation, okay? I feel the sacrum start to counter-nutate. I press and I hold that. Now relax. Okay? Good. Now take another deep breath in. You can also do this. Good. And then relax. Patients like this. The other way you can do this is with them sitting on a stool here. And I, again, maybe use a chair that doesn't have legs that are going to roll, especially when you with fellas, right? So she bends forward. Okay? So this is basically where we're going here. So in flexion, I put pressure on the sacrum. Okay? And I can almost do a hold relax like this. Gently push back up into my hands. Okay? Right to there. No harder than that. You relax. Go ahead and bend down a little more. I'm holding her sacrum in counter-nutation as she flexes. So that's another thing that you guys can do. Now for her, if it was unilateral, you do the exact same technique, but you just do it on one side. Okay? Yeah, that can totally work. So that you can tweak things. It doesn't always have to be in prone. If you're trying to think of what you're trying to achieve, if I want the sacrum to nutate, positioning them into more flexion can totally do that. Patient has the left superior shear. I'm going to stand on the right side of the patient. I'm going to put my hand over the left sacral base. I'm going to abduct the hip just a little bit. So my hand is on the right sacral base. I'm going to come under the ASIS. There we go. I'm just stabilizing the ASIS, stabilizing the pelvis. Relax. She takes a nice deep breath in, and then she exhales. And when she exhales, I give a pressure into nutation on the left sacral base.
As it comes back.
She goes ahead and breathes in again.
So as it comes back.
And I don't let it counter-nutate. When she relaxes, I go into more nutation on that left sacral base. Okay, let's go one more time. Inhale. I keep the pressure down. I don't let her counter-nutate. And then she exhales, and I give her the pressure. Okay? And that's basically it.